Welcome to the Centre for Clinical Haematology at University Hospitals Birmingham. Your doctor has referred you here to discuss CAR T-cell therapy, which is a pioneering treatment for certain types of blood cancer. CAR T is usually considered when the disease has not responded to standard treatments or if it has returned after earlier therapy. In this film, we'll take you through the journey step by step so you and your family know what to expect. At University Hospitals Birmingham, we've been delivering CAR T since 2019, building years of experience and expertise. You'll be cared for by one of the most experienced teams in the country, highly trained and familiar with every stage of treatment. What is CAR T? CAR T stands for Chimeric Antigen Receptor T-cell therapy. It's a way of using your own immune system to fight your cancer. T-cells are certain types of white blood cells whose job it is to recognise and attack infections, and sometimes abnormal cells like cancer. But cancers are very good at hiding from the immune system. With CAR T, we collect your own T-cells and give them new instructions so they can find and attack the cancer more effectively. Your T-cells are collected and sent to a laboratory where they're reprogrammed. Think of it like giving them both a new map and the right key. The map shows them where the cancer is, and the key lets them unlock it and then destroy it. When they're given back to you, these CAR T cells multiply in your body and keep attacking the cancer. At your first appointment, you'll meet both the doctor and the specialist nurse. We'll talk through what CAR T involves, check your health and medical history, and we'll decide together whether it's the right option for you. We'll give you written information so you and your family can read it in your own time and bring any questions back to us. If English isn't your first language, or you need information in another format such as large print or easy read, please let us know. We can arrange interpreters and translated information to make sure you feel fully supported. At this first visit, we'll go through some important paperwork with you. This includes signing consent for virology testing, so we can check for certain infections, a consent form for apheresis, which is the process we use to collect your T-cells, and a privacy notice, which allows us to safely share your details with manufacturing companies who make your CAR T-cells. We'll also take some blood tests and viral swabs, which help us check your health and make sure everything is in place before we move forward. After your first appointment, if you wish to go ahead and we think it's the best option for you, your case will be discussed at the National CAR T panel. This panel brings together experts from across the country to make sure CAR T is the right and safest option for you. Sometimes we'll need to do a few extra checks like scans or biopsies. For people with acute lymphoblastic leukemia, this usually means a bone marrow test. For people with lymphoma, it may mean a lymph node biopsy. These results help us and the National CAR T panel decide whether CAR T is the right treatment for you. We'll ask you to have a dental check before starting CAR T. This is to make sure there are no hidden infections such as tooth or gum problems that could flare up when your immune system is lowered. We'll explain exactly who needs this, and if any treatment is required, it should be completed before you start your CAR T journey. Some patients may take part in a clinical trial. If that's the case, the main steps of the journey will be the same, but there may be extra tests, visits, or slight differences in timing depending on the study. We'll explain everything clearly if this applies to you. Sometimes before we collect your T-cells, we may need to give you treatment to keep your disease under control while you're waiting. This might be chemotherapy, radiotherapy, or other medicines. Once the timing is right, we can go ahead with apheresis to collect your cells safely. Your T-cells are collected using a machine called an apheresis machine. Blood comes out of your vein, passes through the machine, which separates the T-cells, and the rest of your blood is returned to you. This process usually takes around 4 hours. Side effects during collection are usually mild. You may feel tired, a little cold, lightheaded, or get tingling in your lips or fingers. These are linked to calcium changes and can be treated easily if they happen. At your first visit, we'll check your veins. If your veins aren't strong enough, we'll arrange for a tunnelled line to make the collection safer and easier. A tunnelled line is a soft tube placed in the large vein of your chest in theatre, usually under local anaesthetic. It stays in during your treatment and needs flushing and dressing changes once a week. Some of your regular medicines, such as blood pressure tablets or blood thinners, may need to be paused temporarily before collection. This is to make the process safer and reduce the risks of problems with the machine. We'll go through your medicines carefully with you and let you know exactly what needs to be stopped and when to restart it. A family member or friend can stay with you during collection, so you don't have to go through it alone. If you don't live nearby, we can also arrange for you to stay in our cottages close to the hospital, which are provided free of charge by our hospital charity. That way, you and your family member will have a comfortable and convenient place to stay while you go through the collection process. We'll talk more about the cottages later on in this video. Your T-cells are then sent to a specialist lab to be re-engineered, a process that takes 3 to 5 weeks. While you wait for your cells to come back, you may need what we call bridging therapy to keep your disease under control. This can take many different forms depending on your situation: chemotherapy, radiotherapy, steroids, or treatment into the spine called intrathecal therapy. Not everyone needs bridging therapy, but if you do, we'll explain exactly what type is recommended and why. Afterwards, you'll usually need a scan or a bone marrow test, depending on your disease, to give us a new baseline before we move on to the next stage. A week or so before you're admitted, you'll come back to see us again. This is your chance to go through the final details and ask us any questions. We'll review your tests and ask you to sign the consent form to confirm that you're happy to go ahead. You'll also meet with your specialist nurse to go through the logistics of admission and talk through any concerns you may have. You'll be admitted to Ward 625 for your CAR T-cell treatment. Ward 625 is our dedicated haematology ward where we look after patients having CAR T and bone marrow transplants. The team here are highly experienced and very familiar with supporting patients through this treatment. Before your CAR T-cells are returned, you'll have 3 days of conditioning chemotherapy, sometimes called lymphodepletion. This isn't the same intensive chemotherapy you may have had before. The doses are lower, but it plays an essential role. The aim is to lower your white blood cells and make space in your immune system. This helps the CAR T-cells expand, multiply, and work more effectively once they're given back. After the 3 days of chemotherapy, you'll have 2 rest days before treatment. Conditioning chemotherapy is given through your tunneled line. If you don't already have a line, we'll place a tube in your arm called a PICC line when you come in. A PICC line is a thin, flexible tube that goes into the large vein in your upper arm. It stays in place during your treatment, so we can give chemotherapy safely and other medicines. And we can also take blood samples without needing lots of needles. You'll need to keep your line dry when showering. We'll usually advise getting a waterproof plastic sleeve from your GP or pharmacy to wear over the arm so you can shower safely. We'll give you some information about this before you're admitted, so you have time to get one in advance. Conditioning chemotherapy will cause you to lose your hair. We'll support you through this and we'll refer you to wig and headwear services so you have options that feel right for you.
Your cells arrive back to us frozen, are thawed just before treatment and then given back to you. Depending on the type of CAR T you're having, the treatment may be given either as a drip or as a short injection through a small cannula in your hand or arm into the vein. We'll explain which type you're having so you know exactly what to expect. You'll be closely monitored afterwards, whichever treatment you receive. You will need to stay in hospital for at least 16 days so we can monitor you closely, especially during the first 10 days when side effects are most likely. Some people may need a little longer, depending on how they recover. If you're well enough after this, you may be able to go home, but only if you live within about 2 hours of the hospital and have a family member or friend who can stay with you 24 hours a day. If you live further away, or if going home isn't practical, you can move into our nearby cottages. These are provided free of charge by our hospital charity. The cottages are fully equipped with a kitchen, bathroom, living space and bedrooms, so you and a family member can stay comfortably and independently while still being close to the hospital. Living there means you can prepare your own meals, relax in a homely environment, and still be only a short distance from the Centre of Clinical Haematology for your checkups. Many patients and families find the cottages a reassuring halfway step between hospital and home. Whether you go home or into the cottages, you'll need to return to the centre about 3 times a week during the first month. Your specialist nurse will talk through the cottage option with you, and if you'd like to use it, they can help with the arrangements and book it for you. Wherever you stay, having a family member or friend with you 24 hours a day during the first month is mandatory. If you don't have someone who can do this, you'll need to remain in hospital for the whole month. This safety net is essential as your carer's role is to watch for side effects and contact us immediately if anything changes. The reason we insist on this is because CAR-T treatment can cause side effects. These can sometimes be serious and in rare cases, life-threatening. That's why we monitor you closely in hospital at first and why you need 24-hour support afterwards. The most common side effect is cytokine release syndrome, or CRS. This happens because your new CAR-T cells switch on and start multiplying. As they do, they release natural immune messengers called cytokines. These messengers are part of the treatment working, but they can also make you feel unwell, usually with fevers, chills, or low blood pressure. We can treat CRS quickly if it happens. Another possible side effect is called ICANS, a type of brain toxicity. This happens because those same chemicals can temporarily affect the brain and nervous system. It can cause confusion, difficulty speaking, or problems with handwriting. To help us spot it early, we'll ask you to complete a short handwriting test twice a day. If CRS or ICANS happen, we can treat them promptly, and most people make a full recovery. Because these neurological effects can impact concentration and reaction times, you cannot drive for at least 8 weeks after treatment. We'll let you know when it's safe to start again. Other side effects include low blood counts, which increase the risk of infection or bleeding. We can support you with antibiotics, blood products, growth factors, or other medicines when needed. When it's safe for you to leave the hospital or the cottages, you'll continue to be followed up closely as an outpatient at the Centre for Clinical Haematology. In the early weeks after treatment, you'll have direct access to our team. We'll give you a 24/7 phone number so you can contact us straight away if you feel unwell or notice any changes. Please never hesitate to call. Even if you're unsure, it's always better to check. It's really important you and your family know when to contact us urgently. Please call our 24/7 number straight away if you notice any of these: a temperature above 38 degrees C, shivering or chills, sudden confusion, difficulty speaking, drowsiness, severe headache or a seizure, shortness of breath or rapid breathing, any bleeding that doesn't stop or unusual bruising. In the first few weeks, you'll be seen very regularly. We'll check your blood counts, monitor your recovery, and keep a close eye on how you're feeling. Fatigue is very common at this stage, and it can take time to build your strength back up. Because your immune system will be low, there are some day-to-day restrictions. We'll advise you to avoid gardening, DIY, and swimming until your blood counts recover, as these activities can carry a higher risk of infection. If you have pets, you can still enjoy their company, but avoid cleaning litter trays, cages, or handling animal waste until your immune system is stronger. During this period, protecting yourself from infection is especially important. Wash your hands regularly, avoid close contact with people who have coughs, colds, or stomach bugs, and be careful with food hygiene. Make sure food is cooked thoroughly, avoid raw or undercooked meat, fish, or eggs, and keep your kitchen clean to reduce the risk of food poisoning. At around 1 month, we'll do a PET CT scan or a bone marrow test, depending on your disease, to check how well the treatment is working. We know this can be an anxious time while you wait for results, and we'll support you through it. We repeat these checks at around 3 months. If the treatment is working, we'll discuss whether any further scans or bone marrow tests are needed. As your recovery continues, your clinic appointments will gradually become less frequent. From around month 3, you'll usually move into our long-term follow-up clinic. Here, you'll be seen every 3 months for the first 2 years, then every 6 months until year 5, and once a year after that. Everyone who has CAR-T is followed up for 15 years, so we can keep monitoring your health and recovery over the long term. Although the follow-up period is long, most appointments are straightforward, and we'll support you at every stage. If you were referred to us from another hospital, after the first few months, we'll usually share your care with your local team. You will still attend your long-term follow-up appointments here at UHB, but some of your routine care can be provided closer to home. This way, you remain under our specialist care while also being supported by your local hospital. Most people continue to recover steadily after going home, But for some, the immune system takes longer to rebuild and extra support may be needed. We'll explain these longer-term effects next. Some side effects can last longer. Your immune system may be weakened, and you may need protective medicines, immunoglobulin infusions, growth factors, or blood transfusions. If you ever need a blood transfusion, it's very important that you only receive irradiated blood products. This means the blood has been specially treated with radiation to stop certain white cells from causing complications in people who have had CAR-T. This is a lifelong precaution. We'll give you a special card to carry with you, which tells healthcare teams you must always have irradiated blood. Both UHB and your local hospital blood bank will have this information on record, so you're protected wherever you are treated. Because CAR-T wipes out your previous immunity, you'll need to be revaccinated. We'll restart your vaccines against flu and COVID from month 3, and then begin your inactivated childhood vaccines from around month 6. Live vaccines, such as MMR, aren't safe straight after CAR-T, but we'll let you know if and when it's safe for you to have them in the future. To keep things simple, we'll give you a vaccination passport, which explains what vaccines are due and when. It also lets your GP practice know what to do. One reason this long-term follow-up is so important is because your immune system takes time to rebuild, and there's also a small risk of developing a second cancer years later. By monitoring you closely, we can keep you safe and act early if anything changes. It's important to say that CAR-T does not always work for everyone. If the treatment isn't successful, we'll talk with you honestly about the next options. That might include further treatment or supportive and palliative care to focus on quality of life. Whatever happens, you will not be left on your own. You'll always be supported by our team. Alongside monitoring your response to treatment, we'll also help you think about the wider aspects of recovery and day-to-day life after CAR-T. CAR-T treatment can sometimes affect fertility. If this is something that's relevant for you, we'll talk about options for fertility preservation before starting treatment. We also recommend using contraception for at least 6 to 12 months after CAR-T. This is because the effects of treatment on pregnancy aren't fully understood yet. We'll give you personalised advice based on your situation. It's normal to have questions about sex and relationships after treatment. Tiredness, changes to your body, and emotional stress can all affect intimacy. There may also be a period where sex isn't advised, particularly if your blood counts are low. We'll talk with you about what's safe and when you can resume sexual activity. If you or your partner have concerns, please let us know. We're here to support every aspect of your recovery. Returning to work, driving, and regular activities will take time. We'll guide you on what's safe and realistic and support you in regaining your independence at your own pace. If you have questions about finances, benefits, or even things like travel insurance, our nursing team and support services can advise you and point you in the right direction. Many people ask about travel. In the first year after CAR-T, you'll need to stay close to hospital for regular monitoring. Later on, it may be possible to travel abroad, but you'll need advice from your doctor first, especially around vaccinations, insurance, and making sure you have access to medical care wherever you go. We've already talked about not driving for at least 8 weeks. If you experience seizures or longer-lasting neurological symptoms, you may need to inform the DVLA. We'll guide you if this applies to you. You don't have to face this journey alone. National organisations such as Blood Cancer UK, Macmillan Cancer Support and Anthony Nolan offer information, support groups and helplines for patients and families. We can help connect you with these services. Most people find that, with time and the right support, life slowly begins to feel more normal again. We know this journey doesn't just affect patients, it affects families and carers too. Having a loved one go through CAR-T can feel overwhelming at times. As a carer, you're an essential part of the recovery team. Your role in providing 24-hour support in the first month, helping with appointments, and keeping an eye out for changes is absolutely vital. But it's also important to look after yourself. If you ever feel stressed, anxious, or exhausted, please let us know. Support is here for you as well. We'll give you practical guidance, written information, and access to our 24/7 helpline. Remember, you're not on your own. Our team is here to support both you and your loved one every step of the way. CAR-T treatment is complex. At UHB, you'll be cared for by a large team of specialists, all working together to support you. Here's a short introduction to some of the key roles. You may not meet these exact people, but you will meet colleagues in the same roles who are here to guide you throughout your treatment.
Hi, I'm Dr. Chaganti. I'm one of the CAR-T consultants working here at the UHB. I will be looking after you through your CAR-T journey. You will meet our CAR-T team. There's a fantastic CAR-T team that I work with. So I'll be overall in charge of planning your treatment, looking after you, overseeing your care before, during and after the CAR-T cell therapy.
Hi, my name's Brooke. I'm one of the CAR-T clinical nurse specialists. You may meet other members of our team, but we'll be your main point of contact throughout your CAR-T cell therapy and there to support and answer any questions you may have along the way.
Hello, I'm Lavanya. I'm one of the apheresis nurses on the floor. I will be with you during your cell collection, making sure you're safe and comfortable.
I'm Laura, I'm one of the research nurses. Our team will talk to you about any clinical trials you might be eligible for. We'll explain what they involve and if you decide to take part, we'll support you throughout your treatment.
Hi, I'm Lewis, one of the dietitians. Our team's here to help support you with your nutrition so that you can stay well and make the most of your treatment.
Hi, my name is Vaishali. I'm one of the CAR-T pharmacists. Our team will look after all your medications, make sure they're safe and effective. We also make sure that you're happy with the medications, why you're taking it, how to take them and why you're taking it. I also look after all the long-term patients as well. So I may see you there in the long-term follow-up clinic.
Hi, my name is Amrit. I'm working in the CAR-T cell inpatient. We have our patients come in, stay here probably for around 3 weeks. I take care of their requirements with supportive care, issues and complications they have, and discharge them once they are done in around 11 days after their CAR-T cell.
CAR-T is an important step forward in treating blood cancers. It may not be right for everyone, but for some people it can be life-changing. We know this is a big journey, but you will not face it alone. Our whole team will be with you and your family every step of the way, supporting you through treatment and into recovery with hope for the future. The Centre for Clinical Haematology is based at the Queen Elizabeth Hospital, Birmingham. If you're coming by car, please use Car Park D next to the Cancer Centre. The hospital postcode is B15 2GW. If you're travelling by train, the hospital is a short walk from University Railway Station with frequent services from Birmingham New Street. CAR-T nursing team contacts: 24/7 emergency helpline, daytime CAR-T nursing team, Ward 625 reception. Thank you for watching. We know this is a lot of information and you may have more questions. Please bring them to your next appointment. We'll go through everything with you and your family. We hope this video has been helpful and we look forward to meeting you.